I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com.
Millions of us suffer with foot trouble, from aching arches to funky toenails. How can we put our best foot forward? This is the People's Pharmacy with Terry and Joe Graydon.
Our People's Pharmacy podiatrist will bring us up to speed on flat feet, high arches, and everything in between.
Have you experienced heel pain, plantar fasciitis, or foot fungus? What about bunions?
Buying comfortable shoes online can be challenging. What are the best brands for people with wide feet?
Coming up on the People's Pharmacy, flip-flops, fungus, and foot pain. What are your feet trying to tell you?
In the People's Pharmacy Health Headlines, the United States has broken a record this year, though it's not one to cheer about. It's had more cases of measles in 2026 than in any year since 2000, when the disease was declared eliminated. It appears that declaration may have been premature. The current case count is over 2,300, and more than two-thirds of the patients are youngsters. Nearly all of those who have become ill were not vaccinated. The vaccine for measles, which also protects against mumps and rubella, is 97% effective at preventing infection. A large outbreak in South Carolina resulted in more than 1,000 cases before it ended. Pennsylvania and Utah are currently experiencing ongoing outbreaks.
There's growing interest in time-restricted eating. In other words, limiting meals and snacks to a 9-hour window. Researchers at Rutgers recruited 47 overweight postmenopausal women between the ages of 50 and 79. 26 of them were assigned to the time-restricted eating and encouraged to cut 500 calories a day from their diet. The other half of the women also cut 500 calories, but could eat at any time. The women were given cognitive tests before and after the 6-month study. Those who had restricted their food intake to 8 to 9 hours performed better on the tests of memory, attention, and problem solving. Weight loss did not make a difference.
Food is a pillar of good health, so it's not surprising to hear that food insecurity goes hand in hand with medical complications. A new study published in JAMA Internal Medicine demonstrates that making sure people with heart failure have the food they need can cut hospitalizations. The community helped design the intervention named Medically Utilized Tailored Traditional Foods to Optimize Nutrition in Heart Failure. It provided culturally and medically tailored meals to heart failure patients at 2 Indian Health Service sites in Navajo Nation. A total of 206 patients were randomly assigned to receive meals or to get only usual care. By the end of the 2-month trial, 40% of those getting meals had needed emergency care or hospitalization. In comparison, 57% of those who did not receive meals needed hospitalization or emergency intervention. The rate of hospitalization for heart failure was sharply different, 4% versus 13%. The authors conclude, community-based interventions that leverage protective assets of Native communities are needed to advance indigenous health.
Many people believe that cognitive decline is a natural result of getting older, but a new study suggests that worrying about money can accelerate brain aging. British researchers followed nearly 3,000 people born in March of 1946. They're now 80. Researchers tracked them throughout their lives. People who were poor between the ages of 20 and 50 did worse on cognitive tests in middle age. Those who reported having trouble paying bills in middle age also scored lower on cognitive tests. The authors recognized that they could not separate financial stress from behaviors such as tobacco or alcohol use. These are more common in lower-income communities. Men, People who grew up poor and those at high genetic risk because of ApoE4 were most vulnerable to the cognitive effects of financial strain.
Musculoskeletal pain affecting arms, legs, and joints is common and often disrupts sleep. Australian researchers did a systematic review of randomized controlled trials to see if melatonin could help ease chronic pain or the pain following an operation. They found that melatonin could, in fact, help reduce pain intensity and improve sleep for people with chronic musculoskeletal pain, but not pain after surgery. The effect is comparable to that of nonsteroidal anti-inflammatory drugs. The benefits of melatonin for pain include its low cost and favorable safety profile. Side effects may include nausea, dizziness, headache, and drowsiness. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Most of us take our feet for granted until they start to hurt. Whether it's a blister, a sprained ankle, or plantar fasciitis, foot pain gets your attention.
This time of year can be especially challenging because it's a popular time to go on vacation. If you're going to the mountains, you might be hiking or floating down a river on a raft. At the beach, you could be running in and out of the waves. How do summer activities, whether on vacation or at home, affect your feet?
To learn more about foot troubles, from aching arches to funky toenails, we turn to Dr. Jane Anderson. She's board certified with the American Board of Foot and Ankle Surgery and practices at Chapel Hill Foot and Ankle, part of Foot and Ankle Specialists of the Mid-Atlantic. She's a trustee of the American Podiatric Medical Association. Dr. Anderson received the Edwin B. Martin Jr. Award for Podiatrist of the Year in 2025.
Welcome back to the People's Pharmacy, Dr. Jane Anderson.
Thank you so much for having me back. Happy to be here.
Well, Dr. Anderson, we are talking about the summer and what it does to the feet, or what it might be good for the feet. So there's the possibility that there's pluses and minuses. And I think a lot of folks like to go to the beach in the summertime. What are the risks? How do you keep your feet healthy at the beach?
There are some really, really important things to remember when you go to the beach. I think sunscreen is probably the most important thing.
For the feet.
Yeah, so I think it's important that you put sunscreen on the tops of your feet. It's easy to forget that, especially if you go there with shoes on.
Or the bottoms, because if you're lying on the beach and you're, face down, the bottoms of your feet never see sun.
True. That's true.
Yes. And that would be super uncomfortable.
It would be. It would be very uncomfortable. And I think, that's one of the big things to start with is sunscreen. But when you also look at the other things, like how are you going to walk to the water without burning your feet? Is the sand that hot? And that's important to know. Should you be wearing like a water sandal or something that can protect your feet as you walk? And I think one of the things that I deal with fairly consistently is people who have foot pain, such as plantar fasciitis, which is heel pain, or tendinitis, and they're walking on the beach long distances and without support. And that can create a real problem. It can give you those conditions, but it can also exacerbate those conditions.
So, a lot of people love walking on the beach barefoot.
Yeah.
And I'm guessing that that's not always such a good idea. And not just at the beach. A lot of people, I like to walk barefoot every place. I like to walk barefoot at home, in the backyard. So what are the risks of barefoot, and what should they be doing if they are starting to experience some pain?
Well, I think I could start by saying, would you like a list of the things that I have fished out of the bottoms of people's feet in the operating room?
Ooh.
So, and that goes to really people walking barefoot, not necessarily at the beach. I think at the beach, you could certainly step on something that's not good. And in certain waters, you have to worry about sea urchins and things like that, which I've certainly taken those sea urchin spines out of people's feet. But I think, even at home, you have to be careful, especially if you have diabetes where you may not feel it, or if you have neuropathy and you may not feel it, or vascular disease. People walking in their home can step on just about anything. And, when you go to the operating room to take out these foreign bodies, it is not always easy.
Such as? What are some
like
of
a needle. One lady that came in years ago, and she was a lovely woman who she said, I have a tumor on the bottom of my foot. And I looked, and she had this lump. And I thought, wow, she really does have a tumor. And I took an x-ray, and it was an insulin needle. Because as a patient with diabetes, she didn't have the feeling to know that she stepped on that needle.
Oh, my.
So that I've taken out. I had another lovely patient who was rarely walking barefoot, but running through the house, and she had been cutting wire ribbon. And the little piece of wire got lodged in her foot. And those things don't stay on the surface. They go deep inside. I had a wire grill brush stuck in the bottom of someone's heel. I've had toothpicks. I've had rose thorns. I've had splinters, everything. So,
what about glass? I'm guessing
Absolutely.
that's hard to remove.
So it depends on the glass. And the beauty of glass is that sometimes it's more leaded than others. And thank goodness when it is, because then you can see it on x-ray and know what you're going for. So in the operating room, we actually have fluoroscopy, which is sort of live x-ray. So we can see what we're looking for. So anything radiopaque like metal or glass that's leaded, it's much easier for us.
So that diabetes needle, insulin needle, or the wire ribbon you could see. But a lot of glass is not leaded anymore.
Exactly.
Thank goodness.
Exactly. So that makes it much more difficult. And especially if it's been there for a long time. So I had a patient who stepped on something a long time ago, and she had a mass. Like for 5 years, she walked around with this lump on the bottom of her foot. And it was really more her body's reaction to the trauma. So it was like an inclusion cyst it was a walled off area with a lump. So anything can happen. So I guess the take-home message is be careful where you walk. Walking outside barefoot is not a great idea. Even inside your home, sometimes you want to protect yourself, especially with diabetes and vascular disease. And at the beach, when you're walking on the beach little amounts, that's fine. But if you're like, I'm going to go for a 2-mile walk on the beach, when I do that, I choose to wear running shoes, and I choose low tide. So the sand is hard.
Yes.
And I can go out and back and not have that particular problem. So it really is, that barefoot walking can really cause those problems.
Now, a lot of people love flip-flops, especially at the beach, because they're so convenient.
Mm-hmm.
But it's not that different from walking barefoot.
Well,
so you're not getting a lot of support.
definitely don't want to take your 2-mile walk in flip-flops.
Right, but it depends on the flip-flop. So there are some really good flip-flops out there now. And that is something that if you go to our national organization, the American Podiatric Medical Association, apma.org, we have a list of products that have the seal of acceptance, meaning they've been tested. So there are flip-flops on there that made by Vionic, for instance, that have arch support built in, and they're really wonderful.
And so if we go to the website, apma.org, we can trust that the products that are listed there have been checked out and they're going to be okay for our feet.
Correct.
Now, I'm a little puzzled because when I think of flip-flops, I'm thinking flat.
Not all.
And you're
But not
saying
always.
that there actually could be some arch support.
Yes, there are several brands that have really good arch support now. And that probably came about in the last 15 to 20 years. And it was a game changer because before there were just those flimsy little thin rubber things you could bend in half.
Of plastic with a thong.
Yeah. So there are better ones now. And, seeing that everyone wears flip-flops all the time, it's a good thing that someone really took a hold of that market and made that happen.
Well, especially for someone like me with super flat feet.
I have a question about flat feet. What are they, and what do you do about them if you need to do anything
and
about
how
them?
would you know if you have flat feet? Because when my feet are wet, after swimming, it's like I can see a little bit of an arch,
Right.
but not much.
It's mostly an oval, right?
Yeah.
That's really a sign of a flat feet. And a high arch foot is one where you have more that C-shaped imprint.
That's mine.
Yeah. And, to be honest with you, people with high arch feet tend to have more problems even than flat-footed people. So
Really?
there's your competition, you two. You can choose.
Yeah, we need something in between. I had no idea that people with high arches get into trouble.
They can have trouble. So, and
Like what?
if you think about it, it's like a tripod, right? So you're bearing weight under the first metatarsal head, the fifth metatarsal head, and the heel. So sometimes that can be problematic. There's also a genetic condition that's associated with high arches that is not, you don't automatically have it. It's called Charcot-Marie tooth, or CMT, and that is people with high arch feet and neuropathy. And it's a neurologic genetic linked condition that can cause some real problems as people get older. There's not really a cure for it, but that's something that we sort of, like involve neurology with when needed.
Sure.
So when we were at the beach a couple of years ago, the woman who was walking with us was a fast walker. And she was really stepping out. And I was really trying to keep up because I didn't want to lag too far behind.
Of course not.
And she just wanted to keep on going and going and going. And by the time I got home, my big toe was so sore. And the next day, it was completely black.
You mean
not
your
the
toenail?
The
Your
Toenail,
toenail.
not
Yeah.
the toe itself. And it took about a year
Yeah.
to grow out.
Yeah.
Why is it so slow?
So, first of all, it may have been a fit issue for your shoes. So maybe your shoe was a little bit too small for you, and it never was a big deal until you kind of abused it that day. When you get blood underneath the toenail like that, the big toenail takes at least 9 months to grow out. So that is one of the reasons why it takes that long to get rid of that purple dried blood. The important thing to know about this, the cautionary tale, is that if you have blood under your toenail because you dropped something on your foot or you have a traumatic incident other than just repetitive microtrauma like walking, you need to get that checked out. Because if you have a fracture in your big toe and it is an open wound underneath the nail bed, meaning you've got a laceration on your nail bed, then you have an open fracture. And the open fracture is dangerous because it can cause a bone infection.
Ooh,
So you drop something heavy in the kitchen on your toe. I have seen this. I have actually had it happen to me. Who do you check with?
Oh, well, you come to see us.
Okay.
You go to your podiatrist and you say, take an x-ray. And, if you catch it really early, we can drain that blood out from underneath, which is good because then it's less pressure on the nail bed and more comfortable too.
We're
Okay,
going to take a
that's-
short break, but when we come back, we're going to talk about a very common problem this time of the year, plantar fasciitis. What is it? You've heard the question many times. What can you do about it?
You're listening to Dr. Jane Anderson in practice at Chapel Hill Foot and Ankle, which is part of Foot and Ankle Specialists of the Mid-Atlantic. She's a trustee of the American Podiatric Medical Association.
After the break, we'll learn a lot more about plantar fasciitis.
What are the best ways to treat this painful condition?
We'll get tips on choosing a good shoe and how to do stretching exercises that can help plantar fasciitis.
We'll also discuss remedies for smelly feet.
Ooh, should you ice and rest a sprained ankle, or is that advice passé?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you in part by Mudwater. It's an exciting coffee alternative.
Most of us like to start the day with a nice big cup of coffee. I know I do. It smells so good. That alone is enough to wake you up. And there's the taste, too.
But what if your favorite cup wakes you up too much? Starting your day with caffeine jitters is no fun.
Some of our friends have had to give up drinking coffee. It no longer agrees with them. And who needs the heartburn or the race to the bathroom?
Still, they miss the ritual, the steaming beverage, the moment to stop and think about the day ahead. Now we've got something even better to offer them. You'll love it, too.
It's called Mudwater, a coffee alternative made with marvelous mushrooms like lion's mane and reishi that act as adaptogens. You can choose from 4 different flavors, all delicious: coffee, chai, matcha, or turmeric. a wonderful way to start the day with just enough caffeine, only about a seventh as much as regular coffee. The original flavor, chai, has cocoa too. All are 100% organic with no sugar or sweeteners. They're designed to support your immune system and your gut health as well.
You could get started with the starter kit. It has a full-size tin of your favorite flavor, along with a rechargeable frother, free gifts, and free shipping. And you get 43% off with this offer.
Ready to make the switch to cleaner energy? Go to mudwater.com/PPOD and grab the starter kit. Use code PPOD and you'll get 43% off. The frother alone is worth it. That's right, up to 43% off with code PPOD at mudwtr.com. After your purchase, they'll ask you how you found them. Please show your support and let them know People's Pharmacy sent you.
Hi, I'm Jake Grez, also known as Nurse Jake. As a travel nurse, I've worked in all kinds of places, different settings, cities, and climates. Every assignment brings on a new challenge, which is why I always bring my figs. These scrubs are built for whatever the job throws at you. They're breathable, flexible, and comfortable in any environment. No matter where I land, I know they're going to keep me looking and feeling my best. And don't sleep on the details. The pockets, the features, the finishing touches, everything has a purpose, and it makes a real difference when you're moving nonstop. The fit is clean, tailored, and super polished, and they come in a huge range of colors. In other words, they feel great throughout a 12-hour shift, and they always look good. See every healthcare professional on Instagram. If you work in healthcare or know someone who does, check out Figs and get 15% off your first order at wearfigs.com with code FIGSRX. That's wearfigs.com, code FIGSRX.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids. More at getsonu.com. That's getsonu.com.
And by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
We're doing a lot of soul searching today on the People's Pharmacy. That's SOLE. From flip-flops and toe fungus to flat feet and plantar fasciitis. Every year, around 2 million Americans get treatment for this painful condition. 1 out of 10 of us will develop plantar fasciitis sometime during our lifetime.
When I worked as a short-order cook, I had to stand for many, many hours. At the end of the day, my flat feet complained bitterly. How about you? Do you have flat feet? And what does it mean for foot health? Some people have high arches. What kinds of problems might that cause?
We're talking with Dr. Jane Anderson, a board-certified podiatrist in practice at Chapel Hill Foot and Ankle. It's part of Foot and Ankle Specialists of the Mid-Atlantic. In 2025, Dr. Anderson received the Edwin B. Martin Jr. Award for Podiatrist of the Year. She is a trustee of the American Podiatric Medical Association.
Dr. Anderson, plantar fasciitis. It's one of those nasty sounding compounded words. What does it mean? Why does it happen? And what can we do about it?
One of the most common musculoskeletal conditions that we see as podiatrists is plantar fasciitis. And what that is, so the plantar fascia is a band of tissue on the bottom of your foot. It starts at your heel bone and it goes to the ball of your foot. It's like a thick ligament. It's tough, it's thick, and it's white if you look at it surgically. It is oftentimes subject to inflammation. So people will get itis. Anytime you hear the word itis, it's an inflammation of the structure. So plantar fasciitis is inflammation of the plantar fascia. Most commonly manifests as heel pain, sometimes arch pain, usually worse when you first stand in the morning. So your foot hits the ground, you haven't been doing anything all night long, you stand up and ow, it hurts. Early on, generally, you'll walk for a few minutes and it will stretch out and then it will go away. But then as the problem gets worse, it can hurt all day long. And so it can become very debilitating. And I see people, they've had it for 2 weeks. I see people that have had it for 8 years. So you don't want to ignore it is the point. But it's very, very common. So there are many, many things we do for treatment, and it's very controllable once you sort of recognize what it is and, treat it. Our most common treatments center around things like an arch support or an orthotic, which is a custom insole that goes inside the shoes, wearing good shoes, stretching.
Whoa. What's a good shoe?
So you want to make sure that your shoes aren't super flimsy, right? So if you can bend your shoe in half at the middle part of the shoe, it's probably not supportive enough for this particular situation. So a good stable athletic shoe, it doesn't have to be, you don't necessarily want an athletic shoe that has extra support built in. It can be a neutral athletic shoe, but you want to put an insert inside. Stretching exercises are helpful. Icing.
How would you do the stretching?
Well, it depends. There's certain ones where you actually pull your toes back and stretch the fascia. Calf stretches are important for this because most people are tight in their calf muscles.
And how do you do that?
So, like the runner stretch where you lean against the wall and your back leg is straight out back and then you're leaning in. And I like to hold that for about 30 seconds. It's a long stretch.
And that's actually going to also stretch the toes towards the knee at
Right.
the same time.
It
So you
is.
get the stretch happening in both places at once.
Yeah, so the fascia really intertwines through the back of the heel into the Achilles tendon. So the fibers are all connected. So when you're stretching your calf muscles, you're stretching your Achilles tendon, but also stretching your fascia. So that's pretty important. You can do that back leg straight and also the back leg bent. But that's a big piece of the puzzle, right? Those things. Stretching, icing, like massage your foot with a frozen bottle of water for 15 minutes to massage it and ice it. But there are other things that mimic plantar fasciitis. So if you have heel pain, it's probably good to go see your podiatrist, get an x-ray, bring your shoes so they can evaluate, is this the right shoe for you?
Now, what about rolling your arch on a golf ball or a tennis ball? I hear that a lot from my tennis buddies. Does it help?
It does. That's the massage piece of it. I like people to do that, but I also like them to do it with a frozen bottle of water so that they're actually creating a natural anti-inflammatory effect also. So, twice a day you roll with that frozen bottle of water, and then maybe when you're sitting at your desk, you have a golf ball or a tennis ball or a racquetball or something along those lines to actually massage it more continuously.
How soon should you see improvement if you're doing all these things?
Everyone is different. It's really funny. So my protocol for plantar fasciitis, once I establish that that's what it is, because it's not always that, is, I say, okay, you may not walk barefoot. You have to wear something with arch support when you get out of bed. You have to wear good over-the-counter inserts and good shoes. You have to do stretching exercises, icing, and massage. And then I sort of have a divergent treatment plan. Like, okay, do I want to put this patient on anti-inflammatories? Does this one go to physical therapy? Does this one need a shot? Does this one need a boot because it's so severe that they can barely walk, right? So there's different things that we can do. And usually after a month, I see some pretty significant improvement after a while. Not everyone improves at the same rate, though, so you don't know. But the earlier you catch it, the easier it is to get rid of.
Well, we have an email from Hubert who wants to know this. He's got a slightly complicated story here. One morning several months ago when I got out of bed, the ball of my right foot and the surrounding area were swollen and deeply black and blue, but no pain. X-rays showed an arthritic bone in the foot had shifted and was apparently stabbing down into the bottom of the foot. After several weeks of soaking and keeping weight off the foot, that issue resolved. Okay, so right foot is now okay, but it had this weird thing. However, now there's a small spot near the ball of my left foot where I experience an intense shot of pain when I put pressure on it, but only when I'm barefoot. It doesn't happen when I'm wearing shoes. I suspect that's also caused by an arthritic bone. If I'm correct, is there anything I might be able to do short of surgery to prevent this? Have you got any clue what's going on with? Obviously, we can't diagnose Hubert over email and radio.
Right. Right.
But any idea what this might be, and is there any way to treat it?
I mean, it's certainly possible that there's any number of things. It could be like a metatarsalgia, which is a pain on the ball of the foot from the metatarsal bone being more prominent. So in that case, I usually put people on stretches. I evaluate their athletic shoes. Are they wearing the right shoes with the appropriate heel drop, which is a whole nother thing that we can touch
okay.
on. Sometimes do inserts, metatarsal pads, anti-inflammatories, definitely the calf stretches like we talked about. Maybe there's a skin lesion overlying that he can't see. There's little tiny skin lesions that people get that are like a tiny little pebble stuck in the bottom of their foot. So sometimes people come in and they're like, I have this terrible pain when I walk barefoot, and they can't see it, but I can. So
It is
really,
a little difficult to inspect the bottom of your own foot.
yeah, it is, definitely. So, and it's harder to do something about those to yourself, too. So, certainly we can do. So there's any number of things that it could be. I think it's probably wise to just, get it checked out if you can, because it sounds like it's certainly the other foot could have been a similar shifting of bones, and you don't want it to explode again, right? You don't want that to be the case. So a lot of people, if they have one bone that sits down on one foot, there's another one on the other foot too.
Most of us are somewhat symmetrical.
Yeah, somewhat.
So let's shift gears a bit and talk about what I think must be one of the most challenging aspects of your profession, and that is the patient who comes in with smelly feet. I'm guessing that may happen more often than most people would like to imagine. And some people, their own smellers, their own nose, may not be up to snuff, so to speak, and they take off their shoes and socks, and there you come. Whoa. Well, we've got a story from Jan.
Jan wrote in email, years ago I had a problem with stinky feet. My feet and shoes would smell so bad I couldn't take my shoes off when anyone was around. No amount of cleaning would remove the smell from the shoes. I went to a podiatrist who gave me a topical erythromycin prescription that came in a roll-on bottle. I threw out all my stinky shoes and started using the prescription once or twice a day. In a couple of weeks, the bad odor was gone. I kept using it for a while. Then, when my feet seemed cured, I stopped. If my shoes got wet and I wore them for long, the smell came back. So I began to be careful about not getting my shoes wet, especially my tennis shoes. I do always wear socks to keep my feet from sweating too much. Occasionally I have the problem again, but when I do, I just go back to using the prescription and it goes away. So, erythromycin roll-on?
Well, so there is, it's common for people to have fungus in their feet, but it's also common for a secondary bacterial infection to happen. And there's a bacterial infection called Corynebacterium or erythrasma, and you can see it especially with a Woods lamp. So Woods lamp is like one of those purple lamps. So go in a room, turn off the lights, put the Woods lamp on, and it fluoresces coral.
Okay.
So if you see that, the patient needs erythromycin. So that's one of the treatments for it. And there's a few other things that they can do, but that's one of the main things that treats that. So it's likely that that bacteria was contributing to the smell. The only things I would add would be, you know what? Do your best to control your environment, right? So you are in a situation where if your feet get sweaty, this and that. So what are the things you can do? Number one, wear socks that wick moisture away. So that means like acrylic blends that say dry fit, dry weave, dry tech. Do not wear,
cotton.
Not cotton. Cotton breeze, but it holds the moisture in the fiber. So it's not good for that.
What about wool?
Wool is good. Wool is very good also. Natural fiber, very, very helpful. Alternate your shoes every other day. So if your shoes get 24 hours to sort of air out, they are going to be less smelly than if you are, wearing the same shoes day in and day out. If your feet get sweaty, change your socks. Like if you've exercised and things like that. Make sure your shower is clean, that you're cleaning the floor of your shower frequently. And also, take all your socks and wash them in hot water and bleach periodically, just to kind of kill off whatever seems to be living in them, too.
We also have a message from Sophia.
Sophia says, about 2 months ago, after getting my sneakers wet during a rainstorm, I developed seriously stinky feet. It was super embarrassing. Everywhere I went, I would stink the room up. I tried buying new shoes. I bought every odor eater spray, powder, or whatever I could find, and it didn't work. I was about at my breaking point until I tried rubbing alcohol. I rub it on my feet after a shower, and I use it as a disinfectant on my leather shoes, and I've been odor-free ever since.
Yeah, I mean, I think it really is also sort of drying things out. And another way to dry things out if you have sweaty feet that may stink is to soak them in tea. So you brew like black tea,
Strong tea.
Strong, very strong, let it cool, maybe soak for 30 minutes once a day for maybe 10 days in a row, and then maybe once a week. And the tannic acids sort of dry out your sweat glands a little bit.
Will it make your feet tea-colored?
Maybe.
Okay. But they won't smell.
They won't smell as much.
Just out of curiosity, how do you deal with patients who come in with, dare we say it, odorous feet?
You know, I mean, this goes with any part of medicine, right? You could experience a patient that doesn't have full control over their bowels or bladder or what have you. I mean, so kind of some tricks with medicine are, wear a mask and maybe put something in your mouth that is like gum. So, you know what I mean? Like something minty in your mouth so that it kind of blocks the perception of odor. But those are things. I mean,
it goes with the job.
It goes with the job. Yeah.
So let's talk about sprains and strains, because there is now a lot of controversy about rice. Rice stands for
Rest, ice, compression, and elevation. That's what we all learned you're supposed to do if you sprain your ankle, right?
And that was popularized back in the, 70s?
In the 70s, I think, by Gabe Merkin.
Dr. Merkin was a sports medicine doc, and he came up with the term rice.
But I think he was only popularizing something that had already been dogma for a long time already.
But he put a name to it. And now they're saying, oh, no. If you want to recover from a sprain quickly, you actually don't want to use ice. You don't want to use an anti-inflammatory. You want to gently exercise. And I'm having a hard time imagining that exercise.
Well, the description that we found was that you would use your sprained the foot with which you sprained the ankle to write the alphabet in the air. So it's not weight-bearing. You're not putting any actual tension on the joint itself, but you are moving it.
It really, I mean, I think, so first of all, the concept of anti-inflammatories, which ice is an anti-inflammatory, right? I understand this concept because when you have an injury, you want your body to start the healing cascade, right?
Right, and that's
if
inflammation.
If you interrupt the healing cascade, then you don't have as good a healing. So it makes sense to me that these studies are now bearing out that maybe we shouldn't be using ice. We also, when I do certain surgeries where I'm cutting bone and putting bone together and stuff, I tend to avoid anti-inflammatories for pain control postoperatively because I want that inflammatory effect. Sometimes I have to give in because, the patient has to do it. But it's just one of those things where that makes sense to me. And there are a whole lot of things that we do now in medicine that are sort of focused around creating an injury to give something that's chronically problematic an inflammatory jump start, right?
Give us an example, please.
So like shockwave therapy or PRP injections, which are, we draw
PRP?
the platelet-rich plasma. So we draw blood out and we spin it down and inject the platelets back in. So those things, I have a strict protocol for my patients. You may not take anti-inflammatories for a certain amount of weeks before and a certain amount of weeks afterwards because you do not want to interrupt that healing process. And usually these things are done on things that are chronically problematic. So there's no more inflammation happening regardless, right? So if you have plantar fasciitis, for instance, for a year, you're probably really in what we call plantar fasciosis, which is the scar tissue in the fascia. And those things are, generally not responding as well to most treatments. Then you do these things that create an inflammatory response, and it actually can help heal the problem. So I get that. And as far as ankle sprains, first of all, you want to make sure it's really just a sprain. I always think about my mother-in-law who was visiting. She said, I sprained my ankle 3.5 weeks ago and it still hurts. And I took an x-ray and lo and behold, it was broken. And if it's broken, you've got to treat it differently, right? So you just have to make sure it's not broken. And there are different levels of sprain. So if it's a really severe thing, sometimes you really do need to be in a boot, but you can take it off and do your range of motion and things like that. So
You're listening to Dr. Jane Anderson. She's in practice at Chapel Hill Foot and Ankle, which is part of Foot and Ankle Specialists of the Mid-Atlantic. She's board certified with the American Board of Foot and Ankle Surgery, and she is a trustee of the American Podiatric Medical Association.
After the break, we'll talk about bunions. What can you do about them?
There's several different surgical approaches. How do you know which is best?
Bunions are common, and so are hammer toes. What can you do about them?
What is the best way to buy comfortable shoes to accommodate bunions or hammer toes?
We'll also talk about the best way to buy comfortable shoes in general, even if you don't have any special foot problems.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids. More at getsonu.com.
And by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
Today on The People's Pharmacy, we're talking about our feet. What are they trying to tell us? How do we keep our feet happy and healthy? What shoes should you choose? In the old days, we'd go to a shoe store and be fitted in person. These days, you might be ordering your shoes online with a hope and a prayer that they'll feel good.
Our guest is Dr. Jane Anderson, a board-certified podiatrist in practice at Chapel Hill Foot and Ankle. It's part of Foot and Ankle Specialists of the Mid-Atlantic. In 2025, Dr. Anderson received the Edwin B. Martin Jr. Award for Podiatrist of the Year. She is a trustee of the American Podiatric Medical Association.
Dr. Anderson, I'd like to ask about this thing called a bunion. And I've heard from experts such as yourself, not you particularly, but podiatrists, that once you've got a bunion, you've got a bunion, and it's going to be there forever. Well, I had a really big bunion. I'd been wearing boots, cowboy boots. And wow, that was a big mistake because that bump kept getting bigger, and then I got rid of the boots, but I had bad tennis shoes, and that made it worse. And so it took about 2 or 3 years after wearing really good shoes for it to start to recede. And now the bunion is completely gone. So what is a bunion, and what should you do, if anything, besides surgery?
Well, it makes me wonder if you really had a bunion or not, because a bunion is a movement of a bone. So your first metatarsal bone, which is the bone below your big toe, moves to the midline of your body, so away from your second metatarsal. And you get an increase in the angle between the bones, and then the big toe drifts towards the second toe. So you get this bump on the side of your foot. So there are a lot of things that mimic bunions, that maybe, there's like a bad bursitis or something, soft tissue swelling in the area that looks like a bunion, because it's hard for the bunion to reverse itself without surgery. Now, not everyone needs surgery who has a bunion, and there are so many different things that you can consider. Obviously you want to wear round shoes, nothing pointed. Sometimes orthotics can be helpful in controlling joint pain, padding, little spacers between your toes, sometimes medications, anti-inflammatories. Any number of things can help you deal with your bunion symptoms. Bunions are generally genetic to a certain degree. They are exacerbated by shoes. So if you have the bad genes, like you can slow it down by wearing the right shoes and maybe, doing things like wearing orthotics and things, but you're not going to negate your tendency for that particular deformity. So it makes
So
me
whatever
wonder.
I had, I got lucky.
Right. I mean, it seems unlikely that the bone would shift back. So
It seems improbable.
Yeah.
Now, you did mention that sometimes bunions are treated with surgery, and we have a question from Alex, who wrote, 21 years ago, I had traditional bunion surgery on my right foot bunion. 1 year ago, I had new lapiplasty bunion procedure on my left foot bunion. Do you, Dr. Anderson, have an opinion regarding the two surgical procedures? Alex has an observation. In my experience, the traditional bunion surgery result is perfect, but the new lapiplasty procedure left me with a bunion that's only a little bit smaller when compared to the bunion before surgery. So Alex does not sound happy with this new procedure.
So this is kind of an interesting thing. So maybe there's 20, 30 different types of bunionectomies, right? And there have always been many types of bunionectomies. There are more now than there were maybe 20 years ago.
How could there be 20 different kinds of surgeries?
It's amazing. You think about the techniques have changed, the fixation has changed, everything like that. Now there's a lot of people doing what we call minimal incision bunionectomies.
Mm-hmm.
So basically, maybe 20 years ago, maybe there were 16 and maybe there's 25. Now, who knows how many? So we choose the procedure based on a lot of things. Your age, your angle, and your bone. So we may take measurements on the x-ray. What does the joint look like? Is the joint in good condition? What is your activity level?
So you could have a bunion, but the joint could still be in good shape.
Yes.
Okay.
Or fairly good shape.
Why don't we start with what exactly is a bunion?
Right. So a bunion is, like I said, when that first metatarsal bed sort of bone swings out and the big toe swings back the other way, and you get a bump at the side of your big toe joint. And it can be very large or very small, and that doesn't necessarily correlate to how much pain you have.
Uh-huh.
You could have a very large bunion that doesn't hurt, or you could have a very small bunion that does. But historically, we would choose our procedures based on that angle and also based on, what is your activity level? What's your bone quality? Do you have osteoporosis? Do you have, things like that? The procedures that he may be referring to, which who knows? I mean, a traditional bunionectomy may have been a procedure that we do closer to the big toe, where we cut the bone there. That gives you less correction than the procedure at the bottom, the lapiplasty. So when you choose a lapiplasty,
Whoa, what is a lapiplasty?
Which is what?
So this is another, we can go down this rabbit hole. So there's a procedure called the lapidus, and the lapidus is for more aggressive correction of a bunion. And the lapidus is where you address it at the base of the big toe, the base of the first metatarsal, as opposed to addressing it at the head. And it's more aggressive. Now, lapiplasty is a brand name of fixation. So lapidus is the procedure. We've all been doing the lapidus for decades, right? That's a very common procedure. The lapiplasty is a brand of hardware that fixates that.
Oh, okay.
So, and the technique and how it works and things like that. So personally, I do lapidus procedure, but I use a different hardware.
Mm-hmm.
And it is what it is, right? It's just that what works best in my hands. So that's what I do. So lapiplasty has been unique because they've direct marketed to patients. So patients have heard of it now, right?
Okay.
Whereas before, they would have a
would-
lapidus. So even a couple decades ago, or even maybe 15 years ago when I was doing that, I would put 2 screws in and the patient would have to be on crutches for 6 to 8 weeks. Now with the lapiplasty and other fixation, you can walk much faster. So what's happening in our profession is that a lot of people are choosing that lapidus more frequently than they would before. Historically, it was only for very large angles and hypermobile feet. But now people are choosing it for lesser bunions. I personally like the traditional bunionectomies for lesser bunions, but it has to be the right patient, and you have to evaluate every person individually based on what their mechanics are and how their foot functions.
Well, speaking of surgery, I'd like to know about this thing called a hammer toe. I suspect it has something to do with the anatomy of the toes and why they look like a hammer and what you do for it. And we happen to have a question from Karen.
We do. And Karen wrote, I've developed a hammer toe on the second toe of each of my feet as I've gotten older. I saw a podiatrist who said the surgery to correct this is a long recovery process and didn't recommend it. Is there some kind of splint or other apparatus one could wear at night to halt the progression of this seemingly increasing condition? I do wear shoes that have a rounded, roomy toe area.
That's
so
good.
Describe a hammer toe.
So a hammer toe is when one of your toes sort of buckles up and it sits up in the air a little bit with it's contracted, and oftentimes people have pain on the top of the toe or on the end of the toe where that hits the ground. So if you can imagine, they're kind of curled up a little bit.
And it looks like a hammer.
It looks like a hammer. And you can have a hammer toe of your big toe. It's less common, but it's usually like the second toe, third, fourth, and fifth is common also, although the fifth usually curls sideways underneath the fourth.
Well, the fifth toe is so small.
It's so small. Yeah. And the angle of pull of the tendon creates a little different position. Yeah. Second toes are probably the most common and the most problematic too. And there are, like I always say, there's multiple ways to skin the cat, right? You can't, from a conservative standpoint, I recommend the deep shoes. There are taping methods that I use sometimes to help hold the second toe down so that people can wear shoes more comfortably. And that is very helpful. The procedure to fix that, there are multiple procedures, just like there are multiple bunionectomies. If someone is like not particularly elderly, we're going to do a procedure where we straighten that second toe out. Usually we fuse it straight. You can still bend at the ball of the foot to walk, but that is a long recovery. I use a pin that sticks out of the toe for 5 or 6 weeks, which is not the funnest part of the
that
surgery.
Sounds painful.
Right. It's not necessarily more painful than anything else, but that is
But it is a long recovery.
It's a long recovery.
Yeah.
There are lesser procedures that we do for hammer toes that work on certain toes and not other toes. But there are also, you could take something into account. If someone's 90 years old, you're not going to do the more aggressive procedure. You're going to do something really simple.
I would hope
so. And it may not be as effective, but
maybe it's good enough.
Maybe it's good enough.
And do you have to do surgery?
No, you don't. You absolutely don't. So it really is, can they find a shoe that's comfortable? And if they can't, then, there are things we do.
Speaking of finding comfortable shoes.
Very important question.
How do you do that? Because, these days, a lot of people are shopping online. And then if the shoes don't fit very well, they return them. And they do it again and again and again. And I'm sure the shoe company gets really tired of sending shoes. But it must be working financially for everybody. But instead of having somebody who is, quote unquote, a shoe salesman and making sure that it's fitting correctly, you're kind of guessing. And what's the best way to buy comfortable, good shoes for your particular foot?
In person?
Okay.
I mean, really. So, let's divvy this up into like running shoes or, athletic shoes. So when you buy an athletic shoe, you really need to be fit appropriately. There are so many subtleties in how does your foot function? Do you need an arch support? Do you need extra support in the shoe? Do you need a rounder toe box, or are you okay with a more narrow toe box? What heel drop feels best for you? Meaning,
what is a heel drop?
The heel drop is the difference between the back and the front of the shoe. So it means that if you look at, say, like a Brooks Ghost, which is a neutral shoe, it doesn't have any extra support in the shoe, maybe it's got a 10 millimeter drop, meaning the heel is 10 millimeters higher than the front of the foot. Well, that's fine for most people. Sometimes when people have pain on the ball of the foot, wearing a shoe with a little lower heel drop might be better, but that might aggravate someone's Achilles tendonitis. So you really have to kind of know what your conditions are and what you're aiming for. I send people locally to like a Fleet Feet, or we have a local place in Durham called Bull City Running that is very good at fitting people. And most of these places will have a money-back guarantee. So you've got a certain amount of time you can return it if you need to. So that's even if you've worn it. So,
Well, we have listeners all over the country. So when they can't get to a particular shoe store, are there any chains that are especially renowned for good fits?
Fleet Feet is a chain. It's a national chain. Their headquarters are here, but they actually are all over the country. And so that can be helpful.
And how would you know if the person selling you the shoes actually knows what the heck they're doing?
Well, that's a good question. I mean, for us, it's just like we know because we've worked with them for so many years. Generally, the higher end running shoe stores are pretty catering to people because they know that if it doesn't work out, they're going to be coming back.
They'll be losing that
now,
customer.
Some of the popular brands these days are very thick. I mean, they're super high. And
on the other hand, there's also people who are talking about barefoot shoes, which have hardly any.
Right. So there's a huge pendulum, right? Like, so when the barefoot thing started, that was all concerning for us because, people get stress fractures. There are some people that can do barefoot. It's fine for them genetically. They've got a very good structured foot and things like that. But most people cannot handle that because they haven't been walking barefoot their whole lives.
And if you are flat-footed like I am, probably not a good choice.
It's maybe not a good choice. And also, you just have to think to yourself, like, what kind of shock absorption do you have? We have concrete in our world. The people in rural Mexico who are walking with no shoes have dirt. That's what they're wearing, right? That's what they're walking on. So we have to take that into account. There are, all of these maximalist shoes. So not only like the Hokas and things like that, but every shoe now, almost every shoe that I prescribe or that I send people to are coming out with these thicker soles, right? So the Brooks Ghost, as we talked about, Brooks Ghost Max is a little thicker. Really good for some people, not good for everyone, right?
I was going to say, there must be disadvantages to that.
The disadvantage is for older people, if you're unsteady on your feet, you don't want to be in that thick shoe because you're going to feel like you're walking on sand. It's not, and you don't want to do anything that would cause you to maybe lose your balance. So there are some people it's not advantageous. But back to the heel drop, so like a Hoka has a 4mm drop, and like a Brooks Ghost has a 10mm, maybe, I think. The Brooks Ghost Max has a 6mm. So you have to sort of like see what you're doing. And that's where having this extra knowledge is really helpful. And knowing, do you need extra support? Do you not need extra support? My personal preference for support, if you need support, is to put an insert or an orthotic inside a neutral shoe and not use the shoe with extra support. That's my personal preference.
So we're just about out of time. Dr. Anderson, overall, because our feet, we take them for granted until something hurts. And then we can't take them for granted anymore. How should we pay better attention to our feet?
I mean, some good rules of thumb are, number one, check your feet on a regular basis. Especially if you have diabetes, you should be checking every day. Look at the bottoms of your feet. If you see anything unusual, see your podiatrist. Replace your shoes frequently and wear appropriate shoe gear for the activity. So if you are playing pickleball, you are not wearing Hokas that are running shoes because you're going to sprain your ankle, right? So choose the appropriate shoe for activity, like court shoes for court activities and basketball shoes for basketball and things like that. I think those are probably the most important pearls, I would say, to start with.
We've been talking a little bit about smelly feet, and we have this rather painful story from Kurt about losing a girlfriend, or at least a woman that he was hoping to be a girlfriend. Terry, would you tell us about Kurt?
Kurt says, as an adolescent, I worked in the fast food industry, and I stood for hours in shoes that didn't breathe, and they accumulated sweat. My feet were so disgustingly smelly that my siblings and friends would quote the ABC Wide World of Sports tagline and talk about the agony of the feet. If I took my shoes off, the smell of my feet would fill the room. I remember once being paired off in a room with a high school crush and taking my shoes off. The entire room smelled so bad that we thought it was the black Labrador dog that was hanging around in the room. Only later did I realize I had blown my only opportunity with a girl I was infatuated with because my feet were so smelly. I tried soaps, Johnson's Foot Bath, and Desenex, but nothing worked beyond an hour or so. A couple of years later, after seeing how a weak solution of bleach was used to sanitize foot equipment, I thought of trying it for my awful foot odor. I poured about 3 capfuls into a bathroom sink of hot water and soaked my feet for 15 minutes. Voila! My foot odor was gone for days. I never experienced any sort of eczema or reaction to the bleach other than an inoffensive light bleach smell when I let my feet go bare. Years later, I regret the missed opportunity with the girl I obsessed over, but no one ever joked about the agony of my feet again. Straight bleach is probably not a good idea, but a diluted sodium hypochlorite solution? Yes. So what do you say to dilute sodium hypochlorite, which is bleach?
I think you just have to make sure it's really dilute,
Really
right?
dilute.
Because you can really burn your skin with bleach. I mean, that can be really dangerous. And certainly, anyone who doesn't have good feeling in their feet, you have to be careful with the temperature of the water also.
Uh-huh.
But really, you have to be careful not to use too much of that. So that's where, like, soaking in tea, if you brew, like, black tea and let that cool, it's probably a little safer than bleach.
Yeah.
I think it worked in a similar fashion, though, to kind of dry out the sweat glands a little bit, and maybe it killed off some bacteria that was lurking.
Bleach
on
could do
his-
that,
yeah,
yes.
Yeah.
Speaking of bleach, because we've gotten into all kinds of trouble because we generally tell people don't
do
use
this.
bleach. It's
Do not do
way
this at home.
too toxic. And yet we keep hearing from people who say, well, there actually is a medical concentration that's very dilute and it works great, not just for athlete's foot, but also for nail fungus. And we sort of usually discourage that. But nail fungus is one of the big issues that we get lots of questions and answers because people all have their own favorite nail fungus remedy. But before we get into those, we stumbled across a journal article about how to get rid of what was thought to be nail fungus and turned out to be a combination of fungus and bacteria. So tell us about this confusing story that seems to be evolving, that not all fungus is fungus.
That's absolutely true. We culture or take samples of the nails for certain different types of testing for the nails, and it's not infrequent that I get a bacterial result. So it's a little harder sometimes to understand exactly what's the best treatment for that. I'm not sure that we have the right answer. Oftentimes I will include a topical antibiotic ointment on there.
Such as?
Sometimes polysporin, but sometimes just like a prescription one called mupirocin. But it's not, some people use Neosporin, but Neosporin has a very high allergic reaction.
Right, to the neomycin.
Right, to the neomycin. So I don't generally recommend that one. But yeah, and it's hard because whatever you're doing, and for nail fungus, if you're soaking bleach, whatever, the fungus lives underneath the nail in the nail bed. And if you have a lot of fungus, like a lot of thick, crumbly nail, there's nothing that's going to magically get rid of that by soaking in anything, right?
What do you do for it?
Well, it depends. Like sometimes we'll see improvement with oral medication, terbinafine. Sometimes we see improvement with oral and laser together. Sometimes we use a laser with a topical. The really thick, crumbly nails that are 100% involved, people have to have a pretty low expectation of that. So I guess the take-home message is that if you see fungus starting, don't wait till you get to that point before you come to my office because it's going to be harder to treat. If you have just a little bit of fungus, always easier.
what surprises us, especially when people say, oh, I've had this nail problem for years. And then I used an antibiotic like polysporin, or in some cases even Neosporin. And I was amazed. The benefit started showing up within weeks, sometimes even within days. And I was like, wow, why did I suffer with all these fungus remedies that never helped? And the antibiotic really did the trick.
And it would seem that whatever treatment you choose or whatever treatment is effective is going to work slowly over time, because it really works as the nail grows out.
Yeah.
And the big toenail takes 9 months. So if it's working instantly, it makes me wonder if it's just kind of softening the nail and making it look better. And then as the nail grows out, maybe it's really helping, because it's sort of impossible to effectively cure an infection on a toenail the toenail is existing there. It's as it grows out, it responds. So there's nothing fast about treating dystrophic fungal
and
toenails.
We always tell people, don't expect this to be quick. If you want to use, no matter what you're using, even if you're using a potent prescription medication that you're taking by mouth, you still have to be patient, because it's going to take almost a year.
It is.
I'm curious, speaking of prescription medicine, there's something called, I think, Jublia, which is an antifungal topical. It's pricey, and you have to use a lot of it for a long time. And when you actually look at the effectiveness, according to the Food and Drug Administration, it's like after about almost a year, maybe 15 or 20% effective. And I'm thinking, gosh, that doesn't sound so great.
Yeah, I think cyclopirex might even be worse. But, there are 3 FDA-approved topicals for onychomycosis, Jublia, Keratin, and cyclopirex. And cyclopirex is the one that gets prescribed by primary cares most frequently, because knowing how to manipulate the system and get a prescription drug that's expensive covered is really hard, right?
Yeah.
So they just say, just use cyclopirex, which does not work very well at all.
But it's less expensive?
It's usually less expensive, and usually you don't have to go through prior authorization.
Okay.
So that's the problem. So Jublia, I haven't found, this is where seeing a professional is helpful, because when I look at a nail, I'm going to say, does it look like, it's just a little lifted at the end? Is it a little yellowed? Is it white superficial? Is it really thick and crumbly? And I base my treatment not only on what a culture says or what a sample says, but what type of infection we're dealing with and how the nail looks. So it's not like everyone's going to benefit from Jublia, right? So a really thick, crumbly nail, probably not going to do anything, because even the cyclopirex, that was the first one that came out. The original data says if your nail is more than 65% involved, it's not indicated. If it involves the lunula, which is the base of the toenail, it's not indicated. So all these people are using this cyclopirex and these horrible nails, not indicated, right? So it's not even appropriate for that. So I have certain things that I'll do. So like Jublia, if I want to use Jublia, maybe there's a pharmacy that has a contract with the Jublia people that will do it at a lower rate for people, maybe $55 a month or something along those lines, so that they can get it more affordably if it's appropriate. But it's not something I go to routinely. There are, GoodRx is a way that we can sort of get a coupon price for the generic version of Keratin. Mark Cuban's pharmacy, are you familiar with that?
Yeah.
So one of the drugs, the generic of Keratin, is a lot cheaper there than it is even on GoodRx. So if I want to prescribe, I want to prescribe that, that's what I'll use. So, but then, we have all these sort of off-label that the product has ingredients that are FDA approved, but they haven't been proven through the FDA to say I treat nail fungus. That doesn't mean they don't work. It just means that they haven't gone through the FDA process. So like I have one in my office that has tolnaftate and it has urea in it. So the urea softens the nails so the tolnaftate can get in there a little bit better. And I like that one. It works, I think, better than Jublia in many cases. So that's my go-to.
Dr. Anderson, nail clippers. Almost everybody has nail clippers, but some are kind of not so great, and others are really expensive. What do you recommend? Because everybody wants to clip their nails. Are there some brands or some kinds that are better than others?
It really depends on how thick are your toenails and how hard is it for you to clip them, right? Like you can use regular scissors or you can use the regular little ones that kind of squeeze together if you have normal nails. If you don't, sometimes the ones that are like jaws, you know what I mean, that have like a little like opening at the end with a handle that you squeeze, that there are some available even on Amazon that you look at, like maybe you put in nail nippers. There's one of the higher quality brands is Miltex, which is a surgical instrument brand. I've seen them on Amazon periodically, so that could be a thing. It's just you have to use what works well in your hands and on your nails. So it's not always the same thing for everyone.
Dr. Jane Anderson, thank you so much for talking with us on the People's Pharmacy today.
Well, thank you for having me. It's been lovely, as usual.
You've been listening to Dr. Jane Anderson. Dr. Anderson is board certified with the American Board of Foot and Ankle Surgery and in practice at Chapel Hill Foot and Ankle, part of Foot and Ankle Specialists of the Mid-Atlantic in Chapel Hill, North Carolina. She is a trustee of the American Podiatric Medical Association. Dr. Anderson received the Edwin B. Martin Jr. Award for Podiatrist of the Year in 2025.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1481. You can find it online at peoplespharmacy.com. That's where you can share your comments about this episode. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning. This week's podcast has additional information on smelly feet, as well as foot and nail fungus. What remedies or medications work best? How long does it take for that nail to grow out? What are the best toenail clippers?
At peoplespharmacy.com, you could sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast.
If you enjoy the People's Pharmacy podcast, we'd be grateful if you'd write a review of the People's Pharmacy and post it to the podcast platform you prefer.
In Durham, North Carolina, I'm Joe Graydon.
I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.